Join us in welcoming Dr. Mandy Cohen, Centers for Disease Control and Prevention.
Good evening, everyone. Great to see you. I'm Mandy Cohen. I'm the new director of the Centers for Disease Control, and frankly, I'm so grateful to not be speaking about COVID today. But to be on brand, I must remind you to get your updated COVID vaccine and your flu shot. Make sure you're protecting yourself this winter. But thank you for having us here to talk about this important topic of mental health. It is after we focus on the winter respiratory viruses, which does take up a lot of the oxygen in the room, no pun intended. Our big focus is on mental health, reducing suicides and reducing overdoses. And I'm really grateful for CDC to be included in this conversation because I really think it's important for us to take a public health approach as we think about mental health. In order for us to be successful at turning the tide of whether it's the opioid crisis or reducing suicides, we need to take a team approach. And the way we need to work at the CDC to fulfill our mission to protect health, we cannot do it alone. We can't do it in isolation from the CDC. Public health is a team sport. I think we learned that very much in the pandemic. We need to knit together resources. But what I thought I would tell you, and I know we're running behind today, so I'm just going to touch on some of the ways CDC is bringing some resources and how it contributes to this work to make sure when you're going back to think about the alignment work that you're doing in your communities, think about your public health partners as you're doing it. What I think CDC can bring, as well as our public health departments in our state and localities, are data, evidence, and best practices, which we very much need in this space. We need to know what works, we need to know what's happening, and we need to know it fast. So think about public health as we're trying to do those solutions and make sure that we have that big team approach as we're doing the work. I'm going to skip over all the things you know, which is things are not good. We're seeing suicides go up, we're seeing overdoses go up. But the good news is, and I want to share a couple of the places where CDC in particular has been making some big investments around data, research investments, again, in these evidence-based strategies. One place where the CDC's made big investments is about $1 billion that we've put into over the last 5 years and some years coming up is in overdose to action program, overdose data to action program, excuse me. This is our ability to fund our state and local partners to make sure that they are collecting accurate, comprehensive, and timely data on non-fatal and fatal overdoses. That information is arming folks with the information they need in real time to make changes and to react what's happening in their community. So that those $1 billion are now at work in your communities, in 49 states and 40 communities around the country, and we're going to continue to invest there. We also have additional data systems through our vital statistics or our emergency room data where we're working closely with communities to make sure we're aware of what's happening because we can't solve problems we don't understand and we can't see. We're also leading right now the development of a national strategy for suicide prevention. It's something we're working on right now. I know we've engaged with a number of folks who are here and we've been talking about it. It's due out in March of 2024, the draft of which contained 4 strategies: community-based suicide prevention, treatment and crisis services, surveillance, quality improvement and research, and health equity and suicide prevention. So we have a lot of work, and I want to particularly thank the Suicide Prevention Resource Center and the National Action Alliance for Suicide Prevention, who I know are here today. We have worked with them closely. We used some of the results from their needs assessment, which went to about 2,500 participants. We've conducted a number of stakeholder listening sessions to feed into this national strategy. So please look out for that. Again, so data, frameworks for best practices. And then I want to tell you about a few individual stories because I think we also need to tell good stories together as we try to make sure that we're having good action. For example, in Denver, CDC is supporting work where they're looking for ways to decrease stigma surrounding overdose and substance use. And with the support from CDC and SAMHSA, you can now order fentanyl test strips online. That's a great way to decrease stigma. We're also funding research in West Virginia that showed when doctors get alerts that their patients experienced a non-fatal overdose. So when a doctor knows what's happening with their patients in real time, they changed their prescribing patterns, which resulted in safer prescribing and less overdose. So it's those kinds of common sense solutions that we want to invest in. We're also doing work to reach upstream, making sure we're supporting children and families, including a bunch of work we're doing in the school space on youth wellness and working with schools. So a lot of work to get upstream. So thank you for including us again here today. Really appreciate being part of this collaborative effort. Thank you for including public health. Please go back and work with your public health colleagues as you go to align your work and progress for the future. Thanks so much.